I think we stand out from an ordinary hospital because our focus is so much on cancer. And so if you're a nurse, if you're a physician, if you're an administrator, if you're a pharmacist, whoever works here in some way is part of the effort to cure cancer. And when I talk about our institution, from the first person who greets you when you walk in here, the work has begun to try to help. I think we're very focused on the idea that a person is not their disease. They're a human being that has a life very independent of their disease, and our job is to somehow take care of them in a way that doesn't rob them of the dignity that their cancer is already trying to steal from them. And I think that pervades the culture here. We have people who come from other hospitals. There was a patient just last week even who came here very reluctantly from a place where he was, and within 24 hours he had wished he'd been here at the beginning. Not because of what I did, it's because how our nurses took care of him, how they took care of his family, the way the hospital is set up to be a place where you're comfortable while you're getting sometimes rather daunting care. And I think that goes from in every office around here is focused on that, because in some ways everybody we're taking care of is either our brother, our sister, our spouse, children, parents, friends. And I think that provides a certain culture of care that is mindful of that. I think people come here by choice. They don't come here accidentally. There's lots of hospitals. But I think people come here and take pride in the fact that they're being cared for here. I know that in part because a lot of the patients who come here are because of other patients who are cared for here. And I think that speaks well about us. It's not just public relations and talks any of us might give. I think the validation and confidence that people who have been cared for here have in us and are willing to sort of say to someone that they care about, you know, maybe you should go to the City of Hope. And I think our physicians, when they first meet a patient, it's not just about getting their history and examining them. I think that's the beginning of engaging them so that we get to know them and allow them to know us in a way so when they leave, their anxiety is left and they trust that we're going to take their hand and go wherever they need to go.